All right, hello everyone. Today we're going to be talking about neuro physical therapy. So, starting off with the current job standards, education, you need an undergraduate in either kinesiology, biology, or health science, DPT from a CAPTE accredited program, and passing the National Physical Therapy exam. And also obtaining state licensure is important as well. There's a lot of barriers to entry for the PT space. It's highly competitive programs, typically last 3 years. High entry costs as well, ranging from 65,000 to over 120,000. There's limited mentor access as well, and lack of specialized training also leads to different difficulties in the workspace. And also regarding like the complexity of the degrees, like subject matter, a lot of times there's not that many lifelines in place. Networking opportunities, the Academy of Neurologic Physical Therapy and the Academy of Physical Therapy Association, and also the International Neurological Physical Therapy Association are all networking opportunities that you can join in and discuss with other like PTs that are in your field or like in your area, basically. Okay, next. And we have the standards continued. So we have the salary is 85K to 109K, with some top earners making 130,000. Places of practice, they can include inpatient rehab centers, acute care hospitals, outpatient neuro clinics, nursing skilled facilities, some healthcare agencies, academic institutions. They also may work in like specific specialized centers or on activity-based therapy that focus specifically on that. You can really fit anywhere you want with this job. It just depends on which like people need you more than anything else. So some more challenges like in the field specifically, high intensity training and plasticity, adherence to SDOH, addressing SDOH and inequities, the heterogeneity of disorders, how disorders are all different from people, between different people, patients' adherence and lifestyle. All patients are going to come from different walks of life. They're all going to do different things when they get home. They're all going to have different types of motivation, different types of support systems. And then workforce and resources. Again, the workforce is not something that's extremely big because of how competitive it is to get into. And also the resources, some specialized like departments in PT, or like say if you specialize specifically in neuro, there might be some resources that you might not have fully access to as someone who works in a different clinic. So those things are always important to pay attention to. Some challenges continued. Compensation trends, although outpatient salaries have seen some increases industry-wide, they have not kept pace with inflation or the high cost of a DPT degree. Gender pay gap, despite being a female-dominated profession, studies show female physical therapists earn less than males, a disparity that widens as they advance their careers. Reimbursement rates, decline insurance reimbursements, including Medicare, limit the ability of workers to increase salaries. And setting differences. Incomes vary by setting, with hospitals and home health often paying more than outpatient clinics. So again, where you're at in terms of where you're practicing is also extremely important in this case. And then lastly, we have some just general disparities of the healthcare system that tie into physical therapy. Hiring processes are deeply rooted in a lack of diversity within the profession, where 84.3% of practitioners are white, compared to a much lower representation in the general U.S. population. These disparities are characterized by significant underrepresentation of Black, Indigenous, and people of color in the applicant pool, bias in selection processes, and unequal access to just different like networking and social opportunities. So yeah, there's a lot of barriers to entry and like hoops that you have to jump through to become a physical therapist, but depending on where you practice and what you specialize in, there could be avenues and lanes for you to like get in there kind of thing. So yeah, that is it today. That is my presentation, and I hope you guys enjoy. Thank you so much.